So good morning, good afternoon to all of you. My name is Laura Kemp-Peterson, and on behalf of Women of the World Endowment, I would like to very warmly welcome you and thank you for being with us here today on this important day for us as we launch WoWE's first ever Changemakers event during International Women's Month. To launch our series, we're delighted to have Dr. Ruth Shaber, founder and CEO of Tara Health, and WoWE board chair, in conversation with Patience-Marime-Ball, founder and CEO of WoWE. We're going to start our time together today with a conversation between Ruth and Patience, who will then invite us all into the conversation with them. When you are joining in the conversation, please just briefly introduce yourself. Just to let you know, we're going to be recording Patience and Ruth's conversation, but what we'll do is we'll disable the recording when we open up the mic. We plan to finish on the hour to respect your time. So Ruth and Patience, please can you start with sharing how you met and what it was about one another that sparked your initial partnership?
Thank you so much, Laura. And it's really, really exciting to be here and share this conversation with Patience, and also to see all of you. It's really exciting. I met Patience a little over 2 years ago. It was at a Tonic annual meeting. Tonic is an impact investing network, for those of you who don't know it. And we were in this small town in northern Italy. We just had a delightful lunch, and I was leading some workshop on impact measurement. Most of the folks were being very polite, but clearly were very sleepy. But Patience, in her incredible style, was leaning forward, asking the most insightful and provocative questions. And that's when I knew that we were going to be doing some great work together.
Yeah. So for me, Ruth, I didn't know you were having those thoughts, for my questions. I was just taken in. You were describing this integrated capital model, and I was just hooked. I know that we arranged to have breakfast, and I thought to myself during that breakfast, when you shared more about this integrated capital model, I just knew I could learn so much from you, and just wanted to be close.
And thank you, Patience, and it's been quite a fun journey since then. And for those of you who don't know Tara Health Foundation's story, I'll just describe it briefly. We started it 6 years ago. We're 100% mission aligned, which means that we think about every type of capital in our as an asset. And we use an integrated model to build a more equitable world for women and girls. And when we started the foundation, I brought my career in medicine with me, which taught me that merely having evidence was insufficient. You actually need to create the systems and the tools to make sure that the evidence is actually used. And at Tara, we use a portion of our grant dollars to build these tools so that we can invest better. And that's a real paradigm shift for family foundations. We have a commitment to transparency and to influencing others, while we focus on reproductive health and maternal health and workplace equity. We look for investment and grant-making opportunities across all asset classes. When we first entered the field of gender lens investing, I was disappointed to see that most investment strategies that were being used were based largely on looking for companies that had women on boards. And while that sounds great, I knew that there needed to be a stronger connection to the actual outcomes for the women we wanted to help. So in order to get started on this work, we used grant money to commission different measurement strategies. And we partnered with organizations like the Center for High Impact Philanthropy at Pennsylvania, at University of Pennsylvania, and the XX Factor was the product from that. We worked with Wharton developing the 4 for Women structure. We partnered with Equileap to help them go beyond their 19-point scorecard and look at other factors that influence women in the workplace. And Andy, you're on the call today, As You Sow, and how can we integrate some of these measurement strategies into the tools that As You Sow was creating. So we really leaned into going beyond women on boards. And in our strategies, we looked at private equity and started looking at early stage companies that could fill gaps in the reproductive health and maternal health pipeline. We've done private debt and loans to women's health clinics that couldn't get commercial loans. In our public fund strategy, we screen for companies that are the best places for women to work, but we also screen for other issues that we care about, such as avoiding fossil fuels, weapons, tobacco, deforestation, and private prisons. And where there haven't been tools, we use our grant money to build those tools. And we are seeing above market returns from our efforts, which is really exciting. When I was introduced to Patience and her dream for WoWE, I saw it as an important opportunity to provide grant money to build a much broader set of tools than we could ever do at Tara. And WoWE's model of providing due diligence, investing in its own portfolio, providing a roadmap and inviting co-investors, transparently measuring outcomes, and then reinvesting the financial tools is the financial returns. This is the exact model we were looking for to partner with. And WoWE also solved the problem that we were seeing at Tara, which was how are we going to scale what we're doing? I know that with our relatively small corpus, we're not a big enough customer in the financial market to be able to influence the creation of new vehicles or to actually influence how capital is allocated more broadly. So in looking at what Patience was setting up, we saw great opportunity there.
Yeah. Well, thank you very much, Ruth. And in the way that you've just introduced Tara Health Foundation and what you saw in us, I would like to do the same. There are people on the call who are, or in this conversation with us, who are old friends of WoWE. And then there are those whom I would love to welcome. It's my pleasure to welcome you who are learning about WoWE for the first time. So we are a 501c3 entity, and our focus is on investing in, through, and for women as change makers and not just as beneficiaries, which has been the traditional paradigm. For us, we are focused on investing in those women who are driving solutions to today's most pressing environmental and social problems. And as Ruth said, we're doing this through a very ambitious, and I've been told the scope and altitude of our ambition is a little ridiculous, but why not is what I say. After all, we are backing women, and so it's a significant ambition of deploying $5 billion over the next 10 years through a virtual circle of capital. So we're building this endowment, and with our endowment, we are thriving to deliver at least 3 layers of impact. For each dollar that we invest, we're interrogating how that dollar is going to deliver both risk-adjusted returns that are comparable to any other market strategy, while at the same time delivering deep impact. We're also looking at making sure that every dollar is multiplied, because to Ruth's point, none of us have enough capital to really be able to fuel the change that we all want to see. But by making sure that every dollar that we invest is multiplied through investing others to come in and co-invest with us, we're actually multiplying our own impact as well. And then we are also, similar to Ruth, using the returns from our investing to grant make into the strategies that remove the friction out of efforts to actually make whatever we invest in result in systemic change. So systems have these plumbing systems. We focused on how do we go into those plumbing systems and remove the friction so that we can do more with our capital. And I think that our ambition of $5 billion is quite an altitude to reach for. But at the same time, if we want to be in the rooms with other capital owners and asset allocators, those who own significant assets, we need to be that ambitious, and we need to be in those rooms to influence them from within, instead of trying to always ask from outside the room for them to do something different. So our partnership with Tara Health Foundation is incredibly exciting, partly because Ruth, you're a change maker, and you believe in investing in change makers, and in change making. And so it is very much because of your generosity that we're able to do a number of things, that you talked about, but that I just want to emphasize again. Because of that generosity, we're able to embrace complexity, And that means identifying investment opportunities, interrogating them for investment financial returns as well as impact returns, investing in those opportunities ourselves to test our theories and demonstrate, inviting others to come along with us, measuring the impact, being transparent about what we're doing and showing others what's possible. And so it's an incredible pleasure to be working with Terra Health Foundation, but also working with you.
Thank you.
Yeah, and Ruth, so I just wanted to move to a conversation that I think every household has been having, every meeting in this time, in this extraordinary time that we're living through, has been having, which is, 2020 was this extraordinary year. And for us, it's really crystallized our ambition and the potential for acceleration of change. But that needs this investing into change makers. It includes bold thinking. And so I just want to ask you, what is your post 2020 sort of bold burning platform? What does that look like?
Well, the problems that the world saw last year have been there all along, but it really exposed so much about the world's dysfunction. In the US, we saw that women, and particularly women of color, are our essential workforce. They're the caregivers, they're the nurses, they're the respiratory therapists, they're the food service industry. And women are the most impacted by all of the problems, certainly the pandemic. And they're impacted both in volume and the numbers, but also in the degree. And so the unemployment surges for women, lost wages, homelessness, food insecurity, single parenting, all of it. Mm-hmm. But we also saw that women are often the heroes saving the day. Think of all those frontline healthcare workers that we saw leaving the hospitals and getting their applause. Or all the Black women counting the votes for 5 times in Georgia. I can't describe how powerful those images were of the women usually counting votes with the hysterical demonstrators outside banging on the windows with their head down, we're going to get this done. And while women were clearly the most vulnerable to all that had happened last year, they are often not in the position to influence the solutions. But women are best positioned to know what those solutions should be.
Yeah, well said, Ruth. Absolutely. So you've given us this glimpse and of what you saw, what most of us saw, and I think 2020 is an opportunity for us to not let the world unsee, that those examples, right? And we have this opportunity to build back better. At least that's what everybody's saying. So what does that look like? Can we build back better with women centrally involved in the solutions in the way that we saw them do in 2020? Can women as actors, change makers, power holders, asset allocators accelerate this better that we want to see?
I really think so. And certainly, as I said, in my career in medicine, I learned that evidence and systems change is a very powerful tool for improving outcomes. And now we know there's plenty of evidence from the financial markets that when women are in control of capital and the financial decisions, the solutions are often more impactful and sustainable. We cannot ignore that.
Yeah.
So this goes beyond just having women on boards of public companies or more women or female fund managers. It means that we need more women at every point where finance decisions are being made.
Yeah.
And gender investing doesn't just mean having more women making decisions. It also means a more robust consideration of how finance decisions will either impact women and girls or can fully benefit from being in touch with the female markets. Mm-hmm. And now I think we can say for sure that there's a material risk for companies and governments that don't fully engage women as decision makers. So what does that mean for the role of capital in solving these problems? I think we need to consider all opportunities across all investment vehicles to bring women to the table as actors and decision makers. This includes using an integrated approach and really investigating new vehicles and ones that we don't traditionally think of in the gender lens space. So things like like SPACs. Everyone's talking about SPACs, right? Special purpose acquisition companies, or hedge funds, or derivatives, that we can't ignore the places where most of the money is moving in the world. We can't just be relegated to microfinance or tools that have been there more traditionally in the gender space. It's a risk for any investor if they don't consider gender as one of the primary factors in their financial assessment. And given all of that, that's happened last year, Tara Health has really doubled down on our commitments to moving this and driving this field. And so, as you said, Patience, that Tara Health has partnered with you to develop the tools and these case examples of how to fully invest with a gender lens. We've also provided grant money and to help you build your infrastructure and prototyping different vehicles and helping to develop those measurement strategies. And I also made a significant personal gift to WoWE last year to help build the endowment so that you could actually start doing the investing and demonstrate the model. And frankly, I know you've made a ton of money off of that gift, and that above market returns can now be used to fund your operations.
Yeah, no, you're absolutely right, Ruth. To that point that you just made about the fact that we've made a ton of money, your gift came in International Women's Month last year, 2019. So March of 2019, we invested starting in April, and 2020 our returns were about 24%. And all of the investing was done with the level of interrogation that I just talked about earlier on. So Ruth, you just shared a number of ways to think about, what we're seeing today, what is, and how to think about what could be. And as when I do the same kind of thinking, I think about education, for instance, and I think about how women comprise majority of teachers globally. About 66% of teaching staff around the world, on average, it's about 66%. But that 66% of people on the front line of educating our children and educating the future workforce and innovators, etc., they don't have control over education budgets. They don't have control over investments related to education. And so I've been thinking about this and recently had a conversation with a friend of mine who is the founder of an organization called Center for Inspired Teaching. And I asked her, coming out of the pandemic in 2020, what should teaching and education look like? And she said, well, Patience, everyone is fixated on the physical safety of returning to full-time schooling right now. But, we have an opportunity to change so much more than that. So I said to her, what is the more? Could the more be, because I'm a person who lives in the world of finance, could the more be possible if women who are 66% of teaching staff, could it change if, say, they had control over 66% of how of capital allocation to education? And she said, yes, for sure. It would remove the inertia that's in the system today, because for those teachers, it would remove this sense that they are the objects of action rather than those actually taking action. She said, today teachers are, told how to teach. They are told how to, in what order to teach what they teach, how to grade what they're teaching. And this limits their sense of agency and decision making. And that, in some cases, can actually translate to limited responsibility, a sense of responsibility and willingness to inspire their students and franchise their students. She wondered and agreed that control over where capital is being allocated in education would give them a sense of power and agency. And they would translate.
Patience, you set up an interesting, such an important gap between the people who are impacted by a system and the decision makers and actors in that system. How does WoWE's work actually address that gap? What's the intervention that you see?
Yeah. So just coming back to this idea of making sure that or trying to enable those who are in the front lines of doing to control the capital. So, having capital be invested in and through women, I think in education that would actually change how children benefit. So our approach is multi-pronged, but for instance, we are investing into an entity called Urban Innovation Fund, which is a venture capital firm that is led by two women who are MIT grads. They met at MIT. They are looking at providing seed capital and regulatory support to entrepreneurs who are looking at building future and investing into the future of cities, right? So through them, we're exposed to opportunities like CodeSpark Academy, which is a digital platform making computer science education accessible to kids everywhere, especially kids in inner city communities, and also especially girls who are, for the most part, dissuaded from these areas because they're told this is the domain of boys. At CodeSpark, 50% of the staff is female, 50% people of color. They have educators as advisors and as part of the staff. And so, there you actually have people who are on the front lines also having this opportunity to be innovators, to be folks who are translating what they know into how capital is allocated. Another one is Book Nook Learning, which is a digital platform bringing access to world-class reading to children in across America and traditionally left behind communities as well. The founder is the former CEO of Reading Partners, one of the largest children's literacy nonprofits in America. And among her advisors is a former director of teachers education at University of California. Sorry, that was my son in the background. Let me just tell him, a young student who needs teaching. So mom is having a conversation that you cannot be part of. Can you please cease and desist for a minute? I'm sorry. Sorry about that, folks. But that's these are the virtual rooms.
It's the real world.
It's a real world, and he's just finished class and he needs lunch. Anyway, we also know that the work that we're doing is investing into these opportunities that are on investing in these areas, and we as we make these investments and the capital comes back over time, it's evergreen because we take it and we invest it in the next thing. But the income that we make, we are using it to think about how do we use it to remove that friction out of the system so that opportunities like this and ventures like these can actually scale and become more systemic and help even more communities. And then at the end of the day, we're measuring the impact. We know that we can expect impact that includes equity across neighborhoods, greater inclusion, girls being supported in selecting, subjects where boys are traditionally the ones who are expected to be in those subjects. And the knock-on effects are just completely quite, could be staggering. So I'm going to pass the mic on back to you, Ruth, while I figure out how to make my son a little quieter.
I think, Patience, your description of a healthcare, the gap between the workers and the power in education is certainly also true in healthcare. And in my experience in the healthcare system, I know that women represent 70% of the global health workforce. They represent 80% of the buying and usage decisions in the healthcare industry as consumers. And yet very few women are in positions of power within the healthcare industry. They're not the CEOs of hospital systems. They're not the CEOs of pharma companies or insurance companies. And women receive less than 5% of venture capital. And that's where we know a lot of the early stage innovation happens in the biotech space. But we also know that so many of the world's problems actually do focus on women's health. And for instance, better access to reproductive health care is one of the most powerful ways to optimize a woman's economic and social outcomes. and not just optimizing it for that individual, but for her family and her community and even her country. For instance, family planning supports a woman's career and drives economic growth. In Nigeria, a reduction in fertility of 1 child per woman leads to a 13% increase in GDP per capita in 20 years and a 25% in 50 years. And those types of equations are true really around the world. An estimated $1.40 is saved on maternal and newborn healthcare for every dollar invested in family planning, and another $4 is saved per dollar that's spent on treating complications of unplanned pregnancies. Family planning has been shown to be highly cost-effective in reducing preterm births, especially in regions where there are high rates of adolescent pregnancy. And yet, very little is spent around the world on family planning technology or science. If women would having women in control of capital within the healthcare delivery value chain changes relative deprioritization of family planning and maternal healthcare? I think so. And we know there are many opportunities for impact investors, whether it's at Tara Health or WoWE or any of you on this call, to narrow the gap between the impacted populations and the decision makers, the financial decision makers around how that capital is used for that population. If more women are in the position of power, better decisions will be made.
Yeah, I agree with you, Ruth. And I think, you know, we have both done a relatively decent job of looking at the world that is, and, you know, sharing with others what we see as the world that could be, with some changes, and those changes involving women as change makers and central to change. And I just now would like to open the conversation to the rest of the room and see, and you and I can then maybe do some listening and hear, you know, what if scenarios are involved in other people's work. You know, how are others imagining how women as change makers can be central to the changes that they are trying to drive for. So Charlotte, if I may, could I ask you to open the room so that we can invite other what if scenarios into this conversation, please?